Hey everyone, my name is Rachel and I'm happy to welcome you to Mind Matters, a virtual celebration of mental health, trailblazers, talks and activities from local experts and advocates, and a time to learn together with fun trivia at the end. We will also explore the All of Us Research Program, which has launched a groundbreaking initiative aimed at advancing our understanding of health and disease and ushering in a new era of precision medicine. Precision medicine is tailored to address your needs and informed by your personal health. This is an interactive experience, so get ready to celebrate, learn, and join the conversation because your health matters. You'll hear from multiple guest speakers and there will be a Q&A at the end, but please feel free to put your questions in the chat along the way. We will be using the chat to conduct our trivia, so please make sure you know how to use it. Speaking of trivia, we'll talk more about the rules later on and we'll announce the winners of trivia at the end. Please know that you're free to stay off camera, but we would really love to see your face. Before we hear from our first guest speaker, let's first take a moment to watch this quick video to discover how the All of Us Research Program can benefit you and your community.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better until now. Enter All of Us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
Interesting, right? Well, listen, we'll be giving you more chances to learn about the program and ask questions at the end of this event. Next, we've brought a very special guest to help us discuss the state of mental health in Wisconsin, including common mental health concerns and disparities in access to care. Let's pass the mic and get ready to learn.
Hello, beautiful people. My name is Dr. Diamond D. Williams, and I am so honored to speak with you today about mental health. Before we dive in, I'd like to share a little bit about who I am, where I come from, and why mental health is so important to me. My parents purchased our first family home in 53210, a zip code located in the Sherman Park neighborhood that had some of the highest teenage pregnancy, crime rates, and also health disparities. I saw firsthand when the street sign went from green in Milwaukee to blue in Wauwatosa just a few minutes up the road, how it really changed the trajectory of health outcomes and how that further influenced mental health. Currently, I serve as the COVID-19 program manager for the state of Wisconsin Department of Health Service. And while I am not serving on behalf of DHS in an official capacity today, I do want to share how, as a leader of the COVID-19 pandemic and this global pandemic effort, I've seen and understood the significant impact that COVID-19 has had and how it's exacerbated mental health challenges. As people, you, me, and others, we often juggle multiple roles and responsibilities, such as being a caregiver, being a husband, a wife, a significant other, juggling career demands, community leadership, you name it. If you add the strain of balancing these roles along with the impact of racism and/or sexism, it can lead to increased stress, burnout, and other mental health challenges. Today, I am here to simply elevate the power of data and how it can be used to advocate for you, for me, and for the people we love and care so deeply about. Data really helps us to understand and tell the story of mental health challenges that people are facing every single day. One tool I like to make you aware of is the Wisconsin Department of Health Services Mental Health County Services Dashboard. The County Services Dashboard displays which services the public behavioral health system provides. This is found on the Wisconsin Department of Health Services website. If you do a quick Google search, you're able to find this information. So this dashboard was last updated in December of 2022 and can currently be filtered by the year. So going back to 2014, the county, the Wisconsin county, the age group, sex, race, and ethnicity. So you'll see that mental health services have increased by 15.5% from 2014 to 2021. So as you can see here, over 69,000 people were served in 2021. And if you were to filter this and go back to 2014, you'll see that a little over 60,000 people were served in 2014. This dashboard also shows the top 5 most used services. So if we were to filter this back to 2021, you'll see that crisis, outpatient counseling, medication management, comprehensive community services, and case management were the top 5 most used services in 2021. I like to point out how the state of Wisconsin is more in a crisis today than it was 9 years ago today. In fact, you'll see that crisis services increased by 67% from 2014 to 2021. So if you look at the smaller chart that appears, you'll see that in 2014, there were 21,855 people served with crisis services, and 2021, that number jumped to 36,573. So again, this dashboard is super helpful in terms of understanding what services are being used and where we can help allocate additional resources to the community as it relates to mental health. Without the data, it can be harder to advocate for resources, especially in communities of color that may not have access to quality mental health needs or services. It can also be harder to guide the development of effective policies and programs. It can also be harder to monitor the effectiveness of mental health programs and interventions. And lastly, it can be harder to advocate for increased support and resources that address mental health needs of individuals and communities. So I hope this message has inspired you today to make a difference in the lives of others, to destigmatize how we think mental health looks, and to think about the ways that you can continue conversations about mental health. P.S. Don't forget to show up for yourself and make sure your cup is filled for your own mental health and wellness. Thank you.
It is so important that we get access to mental health resources, know where to go, and know how to use those resources. But there are also things that you can do to help address stress and improve your mental health. Let's go ahead and pass the mic to our next guest speaker to highlight the importance of mental health and share some wellness practices.
Hello, everyone. We are so honored that you have chosen to take the time for this Mind Matters event. We know how important this conversation is in general, and again, just so grateful for your time. My name is Raven Exon, and I am a marriage and family therapist, and I'll be here today just to kind of do a little bit of tip sharing on ways that you can integrate some mindfulness into your daily lives. I first want to start with thanking Dr. Diamond Williams for sharing the insight that she did around mental health in our state. We know that information is really important and it helps to inform how we continue to care for ourselves. So as we think back over the last 3 years, we can all appreciate the fact that it has been a uniquely difficult time to navigate, where we all on some level experience loss and grief and feelings of isolation. And we all have gone through that in a different way for our own lives and our own journeys. So really what I think is really important is for us to be able to navigate kind of how do we regain a sense of ourselves as things continue to change and evolve. How do we as individuals choose to show up with a measure of intentionality and focus and clear-mindedness? And that's what these tips are here for. So I kind of organized this thought, understanding how we often kind of care and treat our children and little ones, where there is so much care wrapped around those early years. And then at some point, we all believe that all of those needs kind of get thrown out. So the tips that I'm going to share with you today are really going to kind of invite you to treat yourself like your own baby, to ask those questions that you would ask with your baby, probably before they were able to speak, but they were still sending out signals. So there are 4 key domains that this falls into. The first one is hunger. Now, this is broken out into 3 different questions. So, have I eaten? How have I eaten? And am I hydrated? So, the first one is, have I eaten? So if you have gone, 24 hours without having a morsel of food in your system, perhaps some of the things that you're feeling, even on an emotional level, could be literally because you haven't fed yourself. Then we go to, how have I eaten? So maybe I have had food, but it was food that fed me maybe emotionally, but not nutritionally. And I've been giving my body messages with the first 2 questions. So if I haven't eaten, I'm sending a message to my body that we are in some type of a famine. Or if I've been eating maybe less than amazing, I'm sending messages to my body that I don't have good quality food around me. And then the third question in this section is, am I hydrated? So with our body being more than 70% water, we need to make sure that we are actually giving ourselves on a molecular level water, because it needs it for every single function that your body does. So those are those 3 questions that go into that first domain of hunger. So have I eaten? How have I eaten? And am I hydrated? The second domain is rest. And I kind of shape this more so as your restorative practices. So there are a lot of things that we do in our day-to-day lives that can really leave us feeling a bit depleted. And sometimes being able to go to sleep is enough for that recovery to happen and for us to feel more restored. But sometimes, in addition to having a good sleep hygiene, a good sleep practice, we also need to do other things like being in nature, getting sunlight, taking walks, being around people we love and appreciate, and in spaces where we really feel appreciated. So thinking about that second phase is, are you introducing, or how could you introduce some of these practices that really fill your cup back up, so that when you get to the next day or the next hour, you're able to get through it with a clear-mindedness and focus, and just not feeling depleted as you're going from one task to another, or from one day, 1 week, 1 month to another. Now, this third area is environment. So I like to think of this, we all have seen kids where maybe they were very upset because they had like a tag in the back of their neck or a tag in their shirt that was really irritating to them. And there are things like that in our environment that can just be really irritating and really bring us down emotionally, just make us not feel as comfortable as we would like to in our environment. So really, this is a call to do a general assessment around your environment. Are there spaces that just don't really feel great to you? And if you can identify those, then maybe there are some tweaks that you can do, similar to cutting out the tag in the shirt. Are there tweaks or adjustments that you can make where the environments that you have to be in now feel more comfortable? You feel more welcome to show up. You feel more present while you're there. And you're able to kind of make that quick assessment around your environment. And this specifically is talking about an external environment. So this may be, the different areas that maybe you go to work, maybe you are, in your car, at home, things like that, where you do have the ability to make some updates, some edits, some changes, and just doing a general assessment to feel more comfortable. The final piece here is more so your internal environment. And that is often associated with what's called self-talk. So what messages are you sending to yourself about yourself or about your environment, about the people, the places, the things, the world around you? And this is really important because what we tell ourselves, our belief systems, how we talk and how we internalize messages also impact our worldview greatly. And on an internal level, it tells our body how to prepare for the kind of environments that we're getting ready to go into. So if we wake up with a very long list of tasks, we wake up dreading going from one thing or caring for somebody or something, then your body is starting to associate that all of these things around you are just not good. So then it's kind of like you develop that feedback loop that feeds itself. So every single thing that you then do from that thought on becomes burdensome. And then that's where you become really, really great, where we all do it, become really, really great at identifying the problems, issues, what's not right, become really cynical, and we're becoming cynical about our own life, which then kind of feeds back to whatever other messages we may be saying around this is what my life is, this is what has come of me, and everything we do then feeds that same cycle. The good news in all of this is that you can do the exact reverse. You can wake up and have gratitude as the first thing that you do. So where we say, I am so grateful that I have the opportunity to attack X, Y, and Z, or to approach this topic. I am so grateful that I get to know these people, or that I get to use my skills and my talents in such a way. And from that point on, you are able to then kind of craft a completely different world. And everything else, the same way that belief system worked with that negative feedback loop, it'll work with the positive one as well. Also, in self-talk is a part of mindfulness. So how mindful are you being? And I know that can be a little bit of a trick to figure out how to do it, or why it works, or how it's helpful. So with that in mind, we wanted to kind of do a quick cutaway to Coach Ambrose, who does these deep breathing meditations and mindfulness sessions in general, for us to do a quick 2-minute session to introduce this kind of self-care and self-talk to you all today.
Hello, my name is Coach Ambrose. I'm a mindfulness and mental performance coach at Maspebo Fitness. I'm also a community program coordinator at the Medical College of Wisconsin's Cancer Center in the Department of Community Outreach and Engagement, and my focus is on men's health. Today, I have the honor to lead you through a very quick breathing practice called straw breath. So in moments that you feel anxious, stress, maybe you need a moment to yourself, this is a really easy technique that I typically do for about 6 rounds or 2 minutes. Today we're gonna do it for about 6 rounds, and I'm gonna show it to you first. We'll do it together, and then you have this practice that you can use in any moments that you feel that you need Take a breath. So it looks like this, breathing in through my nose, making a small hole with my lips, and breathing out slowly in an elongated fashion, right? In through my nose, out through my lips. And the simple key here is that breathing in energizes us, breathing out slows us down. And by making the exhale longer than the inhale, this technique has the effects of bringing us into a calm, slower space to be able to then move forward with the rest of our day. So let's begin the practice. Sitting up straight wherever you are. Keep your eyes open or closed, whatever feels comfortable for you. I'm going to close my eyes. What I'm going to do is get us started, and then I'm going to end or bookend our breathing. We're going to do this for about 6 rounds, but do me a favor. You don't count. You just keep focused on your breath. Begin breathing in through your nose. Small hole through your lips, breathing out slowly. And continue on your own. Get distracted, don't worry. Come back to your breath. Start your last round. That's an inhale and an exhale. Relax the breath, relax the body. You can slowly begin to open your eyes. Do a quick check-in with yourself. Again, that technique is called straw breath. My name is Coach Ambrose. It's been a pleasure breathing with you today, and have a good day. Peace.
I do hope that you all found that enjoyable, that is something that you feel like you can apply to your daily lives and practices, as well as some of those additional assessments from hunger, rest, environment, and internal environment. Thank you all so much, and have a good rest of your day.
Wasn't that amazing? I hope that felt refreshing and inspiring. It certainly was for me. Now, we would like to take some time to recognize a few major advocates and pioneers who are elevating the work on mental health. Here's our first spotlight.
This Pioneer Highlight focuses on the founders of NAMI, the National Alliance on Mental Illness. Founded in Madison, Wisconsin in 1977 by 2 mothers, Harriet Shetler and Beverly Young, both had sons who lived with schizophrenia. It has grown to become a national organization based in Arlington, Virginia, with over 600 local affiliates and 2,000 plus memberships in Wisconsin.
Believe it or not, our genetics impact our mental health. The All of Us research program focuses on helping us understand our genetics. Let's check out this video to learn more about the program.
We all have reasons to share our health stories.
Being diagnosed with cancer, it is a very frightening thing. As a younger woman, I would have never thought I would have brain surgery. I would have never envisioned it. I have had brain surgery, I have had breast surgery, and I'm a survivor. Living in a family that really encouraged community service, it meant the world to me to help those in need by providing my information to researchers so that perhaps they can help someone else. Medical research impacts all of us. People of all ages, of all nationalities, of all genders. There are so many needs out there, and the stories need to be told. And I can't think of a better way of helping other people.
Share your health stories today and help guide the discoveries of tomorrow. Learn more at joinallofus.org.
Do you have questions about the program? Please be sure to write them in the chat, and we'll have some dedicated time at the end to hear from you. No question is off limits. It's important that you get a chance to make an informed decision when it comes to your body and your health. Next, let's learn from our keynote presenter. This is someone with an understanding of the impact of mental health on our bodies, and will speak to their vision of how the All of Us research program can impact the future of mental health. I'm so excited to learn from them. Let's check it out.
Well, hello, my name is Dr. Tashaka Cunningham. I'm glad to be with you this afternoon. My background is in molecular biology. That's the discipline that I have my PhD in. I trained at Princeton University as an undergraduate and then at Rockefeller University for my PhD in molecular biology. And for the past 25 plus years, have been working in academia, industry, and government as a researcher, program manager, and executive in the different fields. I'm also the executive director of the Faith-Based Genetic Research Institute, which is a CPGI partner for the NIH All of Us program. So as far as what are genes, genes are essentially the functional unit of what we call heredity. That is the traits that you get from your ancestors, which include your parents, their parents, all the way back to the beginning of our species. So they're made of DNA. So DNA stands for deoxyribonucleic acid. That's the magic molecule. That's the blueprint of life and the blueprint of each individual. So every individual has a unique sequence of DNA of A, T, C's, and G's, the actual components of DNA, the letter code, as we call it, that makes up the specific traits that that individual has. And so the identity of the genes is determined by the sequence of the DNA. And that's how we get mutations that change what the properties of the genes can be. And that's how you can get these different traits. So the sort of central dogma of biological life, as we call it in our field, is DNA to RNA to protein. Okay, DNA encodes the genes. RNA is a secondary step to get to the genes, and then the protein is the final outcome of the genes. So the blueprint, sort of the structure, a bit of the house, and then the actual house, as far as what genes are and how they relate to our changes. So I'll give you an example. If you have a gene for a specific trait, let's say eye color, the actual sequence for someone with brown eyes may vary from someone with blue eyes by maybe an amino acid or a single nucleotide or several small changes in nucleotides, which will slightly alter the protein that would make the eye color pigment appear different. So these are the kinds of different traits that genetics can give you. And all of the variation that we see in our population is generally due to some genetic mutation. That's actually a focus of my company, Polaris Genomics. We are a small biotech company. We're minority owned and veteran owned. And we're really focused on developing better diagnostic tests for mental health conditions using information from individuals' genetics. We're just starting to understand what genes are most important for what mental health conditions. And that's part of the real promise and potential of the NIH All of Us program. Because as we, as the scientific community, can get more data behind what individuals have, which mental health conditions and what mutations they harbor, then companies like mine can make better tests that will help us diagnose people earlier and therefore get them better treatment and have better outcomes. So that's the linkage there. So the more we understand about an individual's genetics, the more we can understand their predisposition for different mental health conditions and as well as their response to medications for those conditions. There's actually quite a large body of literature out there, scientific research on metabolic changes, metabolic protein changes that lead to differential response to different psychiatric medications. So like if you think about serotonin inhibitors, things like that, depending on what your genotype is, that is, what is your sequence of specific genes in your liver enzymes, you may metabolize those drugs faster or slower, so you'll need a higher or lower dose of them. And there are people walking around not even knowing that, trying these drugs and failing on the drugs, and it could just be because they didn't optimize their treatment dose. So that's why understanding more about individuals' genetics as it relates to their mental health is going to become very, very important. The advantage of genomic sequencing, which the technology has advanced tremendously, let's say over the last 25 years, we can now sequence an individual human genome within 48 hours, okay? in some cases within 24 hours. Whereas when the first draft of the human genome was completed over 20 years ago in the early 2000s, it took years and billions of dollars. Now we're at least, the sub, I'd say $300 whole genome. And so we're getting down to the part where everyone can get that done. So what sequencing technology allows us to do is to literally take an individual's DNA and get the actual detailed sequence of each A, T, C, and G that's unique to them compared to a reference genome. And we can say that you have a mutation relative to the reference, and that mutation may or may not be associated with a disease or a tendency to metabolize a drug or any other number of traits that we can ascribe to individuals with those same mutations. So that's why sequencing is so important, and that's the technology that allows us to do it. It's called next generation sequencing. That's actually the technology that allows us to sequence things really fast. And it's really been tremendous to watch as a scientist, the field evolve, because when I first did my PhD 20 plus years ago, we couldn't do it this fast and we couldn't do it this accurate. So now the machines are so much better, incredibly accurate and very sensitive, and can get us the information we need. Our mission at Polaris Genomics is to harness the power of genomic technology to improve mental health diagnosis and treatment. That full stop. That's what we're trying to do. While we're passionate about it, my co-founders are military veterans. They're Air Force and Army veterans, our executive team, and have had a long history with experiencing like mental health conditions like PTSD in the military. And both of my co-founders have a long track record of working in that field. And I also worked in that field a bit when I was at the Department of Veterans Affairs, not necessarily directly in mental health, but in aging and neurodegenerative diseases, that is conditions of the brain, but also being engaged in some of the VA's research activities in genomics and precision medicine as a subject matter expert and liaison for the Million Veteran Program while I was in service at the VA. So our entire team is very dedicated to this issue of improving mental health diagnosis, earlier diagnosis for our military and veteran population, as well as the entire civilian population, so that we can help the mental health care provider community assess people earlier and more accurately. We currently have a shortage of mental health professionals, and their task is really hard to really triage individuals when they come in with these different symptoms that often look like this, the same condition, right? So you can have the same symptoms for different conditions that are in mental health. And it's hard to understand how to treat something when you don't really know what it is. So having some tools that will help the clinicians better classify individuals and understand who's actually most at risk for these conditions, I think is really going to move the field forward. And that's why we're passionate about what we're trying to do. So the way I like to think about precision medicine is kind of the opposite of the current way we've been practicing for hundreds of years, which is kind of like one size fits all, right? Like I used to work in the pharma industry, and we would develop drugs and we would do clinical trials and we'd set a dose for a drug. But before the advent of NGS sequencing technology, we had no way of knowing things like who has a mutation in this liver enzyme that would make them process this drug differently. So it'd be a different recommended dose for them. So it became a lot of trial and error to even figure that out, which a lot of folks never even went through. So you just wound up having people fail the medication, right? So precision medicine allows us an opportunity to really take specific attributes about the individual, including your genomics, your lifestyle, your socioeconomic status, all of these other things, in ways that can help the researchers and medical providers understand the best fit treatment for you. And that's the piece that really gives the most value to the promise of precision medicine, but it starts with getting that information. And that's where the NIH All of Us programs and programs like it come in. They're vitally important to help us in the research and medical community get the data we need to make those associations to be able to deliver better products. I think it's a tremendous potential. And I think some low-hanging fruit right now is just everyone that's taking, a drug for something like anxiety or depression, getting a pharmacogenomic test to know how they metabolize that drug, right? So we can get information on that kind of parameter for everybody. That will help the clinicians optimize the dose. And that when you optimize the dose, you get a better outcome. People don't fail the medication, they get a better progress, they have less side effects, etc. So I think that is a real low-hanging fruit, early stage potential. I think in the future, and that's something that we can do now, and I think we just need to do more of, right? So that could be something that happens more as more people get their genetics tested. The future, I think, will hold our ability to actually be able to diagnose, to proactively identify people who are at risk for these conditions. So we're not quite there yet, but we're going to get there, I think, as we gather more data about what these conditions look like at the molecular genetic level. So I'm going to use the example of cancer. 30 years ago, I don't think we really understood how BRCA mutations led to breast cancer, right? I think the field was just sort of beginning, maybe 40 years ago. I don't know how far it goes back. But now it's kind of a known fact that if you have mutations in the BRCA1 gene, you're very likely to get breast cancer, strong association. So as that body of data has been built over time, if you have a family history of breast cancer, it's now common to be screened for BRCA, right? So I think that is the way that things will evolve in the mental health community as we get stronger and stronger clinical data showing which mutations are most relevant to these mental health conditions. I think, your genetic information is something that is very valuable to you as well as to your community, and you deserve to know it. Right? That's what I say to everybody. It's something that can be very empowering and helpful to know about what's happening with your genetics. For me personally, I've been sequenced 4 times, right? And once I did myself because I have a lab and I can do it, but been sequenced by external providers the other 3. And getting information about what my mutations are has been very empowering for me, and also reassuring. I don't have too many known pathogenic variants, knock on wood, and I have 1 liver enzyme mutant. So I know that if I ever was prescribed this medication, I can already go to my doctor and tell him, hey, I'm going to need a higher dose because I'm going to metabolize this drug a lot faster than the average person. So I'm armed with that knowledge. And then also some other really cool aspects, like I have a mutation that gives me a tendency to have fast twitch muscle, which kind of explains why I've been able to run pretty fast most of my life. And now my kids are actually pretty fast as I'm watching them play sports. So cool little fun factoids like that are just nice things to know. But I think that, my personal experience has been very empowering with knowing my genome, and it's something that I can own and also, benefit from if I ever have some serious health challenges.
I want to take a moment to say thank you to our keynote and each of our guests. It's an honor to share this space with you and to keep elevating the importance of understanding mental health. As we move forward, our next guest will talk more intimately about how the All of Us research program and its findings on mental health could lead to more impactful treatments and interventions.
So I'm a clinical psychologist. I work part-time at the VA and part-time at the Medical College of Wisconsin. In my Medical College of Wisconsin role, I serve as the site co-PI for the All of Us program, which is one of the largest genomics and precision medicine initiatives going on nationally. It's funded by the National Institutes of Health. It was initiated under President Obama's administration, and we've been carrying out his vision and sort of the vision of the White House and the National Institutes of Health for several years, just trying to collect genetic information from as wide of a group of people as we can. We really feel like that's going to advance healthcare over the next several decades. How can this genetic information be used to better understand our mental health? And there's some really interesting advances that are coming up in that space. And as a psychologist, I have to kind of keep up with that. It's not necessarily that it's impacting my practice at this moment, but for psychiatrists, it's already starting to be something that they have to factor into clinical care. It's an incredibly complex arena, and for folks in the community who think this is confusing, it's confusing for the scientists that are involved. There's just so much information, many different data points, a lot of genes and variants of genes, and we're trying to sort of sort out over time, really over decades, which ones of those genes are important for us to worry about from a healthcare perspective. And that's taking some time, and it's really, it's a process. What we have discovered, for example, is that with genetic information, we can see that there are genetic commonalities with 5 different mental health disorders or conditions that are important for us in the community, right? They impact everybody, but some of these also impact communities of color differentially, right? There's a higher prevalence of some of these mental health issues. So those 5 that have, again, common genetic factors are autism, ADHD, bipolar disorder, major depression, and schizophrenia. For example, schizophrenia often impacts African American communities more frequently than white communities, and sometimes at a little bit younger age. And we don't really know why. And I think a lot of times there's a lot of stigma associated with some of these more complex mental health disorders. Within our communities of color, folks often just haven't wanted to talk about it. They might even kind of try to put the person that is maybe having some of these problems behind closed doors. In the Hispanic community as well, right? There's just a lot of misunderstanding of mental health problems and a kind of a reluctance to discuss it outside of the home. So, you know, these are serious problems for people. They really impact daily life, not only for the patient, but also for the family, right? There's a lot going on in terms of quality of life. So for the first time, we have really information that is saying for these 5 disorders, there are some common genetic factors that actually have to do with our physical body and what we've received from, you know, our lineage, from our heritage. And that starts to bring up questions about, can we tailor medication differently for these particular patients that's targeted to that genetic variation. And so just to be technical for 1 second, you know, we see the variations around some what we call alleles, little pieces of genetic information in the CACNA1C and the CACNB2. And I'm using some technical language that I don't even understand fully because I want to give people sort of a grounding in what does this mean? Those genetic components actually control calcium flow into certain cells. And that in turn impacts thinking, attention, memory, and emotion. And so, you know, we're often thinking, well, just to use the terms that are used in the street, this person's crazy, this person's whatever. We're getting a better understanding. This is part of their physiology. This is part of how their body was built. It's not just in their mind. The mind and the body are so deeply interconnected. And so the next question that comes from that is, can we start to target medications for that particular person based on this genetic variation that they have? So I do more talk therapy, but I work with psychiatrists every day. And they're working at the drug or prescription medication level with patients that have, you know, a range of problems that I'm going to be seeing and working with as well. And so where I get excited is not just the science, but really when we start to talk about clinical decision rules, right? So clinicians, providers, however you want to think about it, doctors and psychologists, we're given sets of rules. In this situation, you should do this, right? In this other situation, you should do something else. And for the first time, we're really seeing, especially for psychiatrists, clinical decision rules, what they should prescribe or not prescribe, and what genetic tests they should run to understand how best to prescribe, really coming into clinical practice for the first time. And I'll give you a couple of examples. So there's a group called the Clinical Pharmacogenetics Implementation Consortium. It's kind of a long name, abbreviated it's CPIC. And they have just published a clinical decision rule set for things like serotonin-specific reuptake inhibitors. And I'm using the technical words here for people's familiarity with some of the science. But when I say serotonin-specific reuptake inhibitor, those are drugs like Prozac, Lexapro, Celexa, Paxil, Zoloft. Right? These are common medications that are used as first-line antidepressants. Folks in the community are prescribed these drugs all the time. For the first time, we're really looking at how do we prescribe, understanding the person's genetics, and is that the right medication for them? And there's also some clinical decision rules that are coming up now for tricyclic antidepressants as well, right? So these are clear and present things. How does depression impact us? What are the genes that impact also how we metabolize the medications that are given for depression? And that may change person to person based on your personal genetic data, right? And for the first time, doctors, psychiatrists are actually being asked to run certain genetic tests to understand what is the best medication for depression for this person. That's a huge shift from where we were 20 years ago, even 10 years ago. Some of this clinical decision-making rules about genetics wasn't even there. One of the hopes with precision medicine specifically, and all of us falls under this sort of precision medicine initiative at the national level, is to really think about what are the side effects of certain medications if the person's genes are different than what you expect. And this is where we've gotten into trouble in the past for 2 different reasons, really, with side effects. One is, I think very commonly people go to the doctor, maybe it's for a mental health issue, they get the medication, and the medication has side effects that maybe put them to sleep, or changes their blood pressure, or makes them feel really, really bad for whatever reason. And then they go back to the doctor and say, this isn't working. And that cycle of trying medications out multiple times, experimenting, in a sense, the physician is trying to experiment which medication, what dose is going to be right for this patient. And both the patient is frustrated and the doctor is frustrated at the same time because they're not sure and they're trying different things out. There's a lot of burden on the patient to come back and come back and come back. One of the hopes with precision medicine, and we're not quite there yet, right? Some of this is going to take several more years of work. But the hope is we run some genetic tests, we understand what the side effect profile is for this specific patient, and we're able to prescribe one time in a way that's going to minimize the side effects, right? And I think that's going to be, again, a game changer for patients. Once in a while, I'm just saying, once in a while, that misunderstanding about what the side effect profile is for a medication can be fatal, right? And the side effects profile for Black and Brown communities is different than it is for the white community, the normative white male, middle-aged man, where most of the genetic research has been done to date. And it's just differences in how we've metabolized food and the environments that our ancestors were in, right? It's not a difference in anything else except kind of what our heritage has given us, right? But that actually impacts our ability to metabolize certain medications. If the physician isn't aware of that difference, once in a while, that results in a very serious side effect event. And that can be life-changing for people. So we're also hoping, there's the day-to-day of we want to be able to stop having to kind of try multiple drugs. And then there's also this sort of emergency event that we're trying to prevent as well. People are suspicious of anything that's this intrusive, and I get it, right? And I think that I want to just say it this way, I wouldn't have decided to work on this project if I felt like those pieces of information were going to be at risk. I can't really walk into the Hispanic neighborhoods that I'm trying to really be present with, right? Because that's where my grandparents came from. I can't walk into those communities and shake people's hands and say, I think this is good to sign up, if I can't also personally believe in the safety and security of that data, the privacy of that data. So for me, it really comes down to a couple of factors. One is that this is very complex information, but we split it into three different parts. So your genetic information and your identifiers and other types of data, so like the blood samples itself, those three pieces are separated completely and stored separately. And they're only brought back together when we need to provide you as the participant with information about your genetic profile. For example, we want to give you back information about your genes and your ancestry so that you can make different health decisions if you want to, or you can understand what your heritage is. But for the researchers, they only get de-identified data, and we store it in a de-identified way so that in the off chance that it would be breached, people might be able to look at this genetic information, but they don't know who it came from. And we're extremely careful about that. That data is stored in a data warehouse that's approved by the federal government, and it meets the highest standards for data privacy and protection. The other thing about the insurance companies getting this information is also a really serious concern, again, for everybody, but especially from communities of color. And so for this project, we're protected by the GINA Act, which is a federal act that says genetic information that's stored for research purposes cannot be used by insurance companies. And we also have, for this project specifically, a certificate of confidentiality, which prevents, for example, law enforcement from accessing the genetic information in this database. And you can imagine a number of different scenarios where people would be worried, not even for themselves, but maybe the way things are going with law enforcement, they might be able to track a relative from my genes, for example. And so we have said we can't, for research purposes, we can't have that happen. If people are donating their blood for the good of science and for the good of humanity, that's not something that we want to have occur. So at the start, that certificate of confidentiality was put in place. The only caveat that I will say is that if you ask for your health information, your genetic results from this program, now you know something about your genes, and a health insurer could ask you, do you know something about this? So people need to be a little bit careful of, are you really contributing for science, or are you trying to understand for your own healthcare? So the one caveat is, if you decide to know what your genetic return of results is, a health insurer could ask you questions about that. And we're not able to sort of stand in that space between you and your insurer. But if you just give us data, we cannot give it to an insurer. I'll just say it like this. I'm a PI for this project, which means I'm one of the lead researchers. For a lot of the same reasons that the communities that we come from are worried, I was worried. It took me a while to really, even though I personally felt a lot of confidence about this and I wouldn't have served as a leader in this project, it took me a while to really get to the point where I was willing to donate blood myself. Really almost for spiritual reasons, personal reasons in my own belief system. But at the end of the day, I felt like my father, who was also born in Mexico and spent his whole life trying to do science, would say it's important to be brave in the face of the unknown, right? There's a lot of unknowns with this research. And yet we believe the reason we come to work every day is that we believe that the All of Us program is going to transform healthcare for everyone. That's in the name, all of us, the entire spectrum of the American populace, everybody from every different possible background and walk of life. In 20 or 30 years, when my children are coming of age, really into their full adulthood, that's when the payoffs from this program are going to be there. And I think some of the issues that have even impacted my own family, diabetes, strokes, different health things that have impacted us, I have hope that those things will be better addressed than they ever have been through the All of Us program, and that my children will reap the benefit. And that's an investment in the future, in our children's future. And so I'm just hoping people see the value of that, even though sometimes it's a little scary to kind of participate in something that's so big and sprawling.
Absolutely. Well, with that, I just want to thank you for your time.
Do you have questions about what was shared? If so, drop them in the chat. Next, we would like to take time to recognize another mental health pioneer.
This pioneer highlight focuses on Dr. Harry Harlow, a pioneering psychologist and researcher from UW-Madison. He was known for groundbreaking studies on social isolation and the vital role of social relationships in mental health. Dr. Harlow's work shaped our understanding of early experiences' impact on mental health and inspired advancements in psychology.
Let's honor each of our pioneers for their contributions. We're almost ready for trivia, but let's give you guys a few more chances to learn about the All of Us research program.
Sharing your health story matters.
I knew since I was 5 years old that I wanted to be a nurse. I equated it to helping people and making them feel better. I am gently retired, but even though I'm not at the bedside, I'm able to do just as much work in the community. I've been fortunate to participate in All of Us.
Joining the All of Us research program means contributing to research that may help people of different backgrounds.
I received DNA genetic profiling that showed that my body metabolizes medicine slower than average. Now I had proof of what I've known about myself all along that is specific to me, to my genes. I'm sharing my story because if I can make a difference, then I'm all in.
Share your health stories today and help guide the discoveries of tomorrow. Learn more at joinallofus.org.
Welcome back. We hope you've been enjoying yourself. Now who's ready to play a game? Remember, you will need access to your chat to play. Here's how the game works. Number 1, there will be a total of 6 questions in the game. 3 winners for each question, and every winner wins $20. Only 1 answer is allowed per person per question. Number 2, all submissions must be entered into the chat before the countdown ends. Only responses included before the countdown ends will be included. Number 3, our team is watching the clock and will put a note in the chat when the countdown is up. Also, because we're announcing the winners at the end, stay focused on the game and keep playing. The questions will be asked back to back. We will be keeping a close eye on the chat, and all winners will be announced at the end of the event, so please make sure to stay with us. Now, let's hand it off to our game host, Carrie, and guest speakers to play the game. Have fun!
What is heredity? A, the passing of genes from parents to offspring. B, the study of genes. C, genetics. Or D, plants scattering pollen. Now we'll kick it over to Dr. Zeno Franco from Froedtert and the Medical College for the right answer.
The answer that you're looking for there is A, the transmission of genetic information from parents to their children is a great example of heredity and how heredity works.
What is the study of heredity called? A, hereditology. B, DNA. C, genetics. Or D, biology. Now we're sending it off to Dr. Jeff Whittle from Froedtert and the Medical College of Wisconsin.
The correct answer is C, genetics. Genetics is a term that refers to the study of genes and their role in inheritance, the way certain traits are passed down from one generation to another.
What are genes? A, small units of DNA. B, small units of chromosomes. C, small proteins. Or D, cells from our bodies. We're going to head to Dr. Jeff Whittle from Froedtert and the Medical College of Wisconsin for the correct answer.
The correct answer is small units of DNA. That's A. A gene is the basic physical and functional unit of heredity. Genes are made up of DNA. Some genes act as instructions to make molecules called proteins.
What does DNA stand for? A, dominant nuclear acid, B, deoxyribonucleic acid, C, daily nursing apple juice, or D, denominator of numerous alleles? Let's hear from Dr. Jeff Whittle from Froedtert and the Medical College of Wisconsin for the correct answer.
The correct answer is B, deoxyribonucleic acid. So DNA, or deoxyribonucleic acid, is a hereditary material in humans and almost all other organisms.
What are alleles? A, a unit of measurement in genetics, B, the available forms that genes take, C, the color of your eyes, or D, the shape of your nose? Let's hear from Dr. Todd Marr from Gundersen for the right answer.
Alleles are the available forms that genes take. So mutations in germ cells, these are sperm and eggs, can be passed along from generation to generation, and they provide the basis for the many variations in phenotype that make each of us really unique. Over time, mutations have created variants of genes that are responsible for differences in the color of our hair, our eyes, and our skin. And mutations influence our intelligence, our height, our weight, our personalities, our blood pressure, our cholesterol levels, and really even how fast we can run.
Wasn't that great? Thank you so much for playing. We are reviewing the chat and will announce the winners shortly. In the meantime, let's watch our final mental health pioneer highlight of the evening.
A mental health professional and advocate for more than 25 years, this pioneer highlight focuses on Corinda Rainey Moore, who was the first and only African American to lead not just one, but 2 peer support programs for adults with severe and persistent mental illnesses in Dane County, Wisconsin. She is also the first and only African American to have served as chair of the National Alliance on Mental Health.
Interested in joining the All of Us Research Program? Attend our pop-up event at El Bethel Church in Milwaukee tomorrow, May 31st from 2 p.m. to 6 p.m. Not in Milwaukee? Join us at joinallofus.org/Wisconsin. Be a part of groundbreaking research.
Learning about the state of mental health in Wisconsin, mental health resources, and the All of Us Research Program is a lot of information. Thank you to each of our guest speakers and each of you for staying engaged. We're finally at the end of this amazing event and we'll prepare for our Q&A. I have loved being your host, and on behalf of the All of Us Research Program, thank you so much for joining us. Now let's open up the questions and we'll announce the winners live.